What could you say to someone if they were to walk up to you and say, hey, what is the CMP exam and what are the things I need to know about them?
So first thing, C&P exam, it stands for Compensation and Pension Examination. So this is what the VA uses to evaluate your condition, to determine if you have a nexus, so if it should be service connected, and what your rating should be. So they are essentially going to base their decision on this C&P exam. So it's probably the most important part of your claim.
But is it really necessary to go to a CMP exam? I mean, if you already have a diagnosis in your record and your doctors have already sent everything in, are they required to have CMP exams?
That's a great question. Yes, you have to go to your C&P exam because if not, they will deny your claim. They will mark you as a no-show and it will just be an automatic denial. So even if you feel that your evidence is already in there, you still have to go to the exam.
Yeah. And it is not a bad thing to be scheduled for a CMP exam. So if you are scheduled for an exam, it means that VA is really taking your claim seriously and they want to see if it's going to be eligible for rating. So you're going to go, and that's where they're going to find out what your rating would be. They're going to get medical opinions on whether or not it could be related to your service and all those types of things. So it is very important, like Melanie said, to show up to those exams if you are scheduled.
So Ursula, tell us, when a veteran goes to a C&P exam, what can they expect?
So when they first show up, they can expect the unexpected, if you will. It all just really depends on who VA has contracted out that examination to be with. So there are a couple of different contract organizations that VA will use. They will also use their own compensation and pension examiners that are within VA. So sometimes you may get a call or an email from one of the contracted places to schedule the exam, and you may also get a letter. So if you are getting called by one of these companies that say, we need you to show up for an exam, they're going to let you know when and where that exam is, and you may or may not know what the conditions are. At the point of scheduling that exam, you could ask, but you may not get that information. So just keep that in mind. So once it's scheduled, you would show up to the exam, and like I said, it could be at a VA or it could be at an outpatient doctor somewhere else. And when you go in, you will meet with one of the contracted providers and they will perform the examination.
So some of the names that you might want to look out for, LHI is one of the contracted providers. QTC is now Optum. So you may have heard of QTC before. Now they go by Optum. So those are the contractors that they often partner with to conduct the C&P exams. Another thing you may want to just be aware of is you may be going in for an evaluation for your mental health condition, and it may be a podiatrist that's examining you, or it may be a neurological condition that you're having an exam for, and it could be a nurse practitioner. No disrespect to nurse practitioners, but you will see a wide range, and it won't always be the most qualified professionals for the condition that you are being evaluated for.
Yeah, and there are some certain types of CMPs that need to be held by certain types of doctors. For example, a hearing loss needs to be done by a doctor and audiologist. Mental health needs to be done by a psychologist or a psychiatrist specifically. And traumatic brain injury, typically we're looking for a neurologist or a psychiatrist for those. And so it is important to pay attention to the type of practitioner or person performing your exam to make sure that they are actually qualified for that exam. What can veterans expect when they get there?
The first thing you should know is the examiner will take everything you say very literally. So you want to be very aware and cautious of the information that you are giving. Meaning, if they ask you, how are you? And you say, I'm good, they're gonna write that down and say, veteran is good today. That doesn't necessarily happen every time, but we have seen it happen before. So it's just something to be careful of. You'll want to think about, go in thinking about your worst days, when your symptoms are at their worst. So this is just one snapshot, one day of your daily life. So the examiner isn't getting to see all of the different difficulties that you face. So you want to make sure to convey that to them. Sometimes it might just be a 5-minute conversation or 10 minutes. Sometimes you'll have a thorough examiner who will spend an hour with you asking you everything that they need to know. But you can't rely on that. So you have to be sure that you give them the information that you want them to know to get the highest rating possible. So again, think about your worst days and convey that to them. So give them examples of the times where, you know, if it's mental health and you have a hard time getting out of bed, or, you know, the different examples of symptoms that we've talked about. Be specific, give details, give examples. Don't rely on the examiner asking you questions because they may not.
Yeah, and I know we talk about mental health a lot, but another one to think about is when we're talking about orthopedic conditions and you go in for your CMP exams for those. Sometimes they're going to go through and measure you and say, bend your knee, do this, do that. And if you're not actively in a flare up, they're not going to be able to see, you know, what those limitations really are. So make sure that you're explaining, yes, I have flare-ups. When my back hurts, this is what happens. I can't do this and I can't do that. Even if on that day you're feeling okay. Like Melanie said, it is so important to remember your worst days because you really want VA to know what it's like on your worst days, not on your best days.
If you have assistive devices like a cane, a walker, bring those with you. Because again, you want to give a clear picture of your everyday condition and not just the one day when you may happen to be feeling better.
And one of the things that you could use that's a really great tool before you go into the CMP exams is you can actually get a copy of a form that's very similar to the layout and setup of the CMP exam. So you can find those forms on the VA website, which is linked below, for just about any condition that you may have a CMP for. And if you take a look at that, you can familiarize yourself with the things that they're going to be looking for, the questions they may be asking, and really be able to advocate for yourself to know that they're going to say, okay, what are these symptoms that are present? What is the range of motion on a flare up? What are the symptoms associated with it? So take the time to read over those DBQs for the conditions that you're trying to get either service connected or an increased rating for, so that you know what criteria and what they're going to be looking for.
And think about all of the different symptoms and limitations that you have associated with that one condition. So for example, the back condition, if you look at the DBQ, there's one section where it talks about radiculopathy, which is the way that the pain radiates from your back down into your legs. That's something that you could get a separate rating for. So you may not know that that's related and that it's connected, but if you tell them about that, again, they may not ask, but if you tell them, that should be in the record, and then you can get a separate rating for your radiculopathy.
Yeah, and especially if they note that on the CMP exam. Once the CMP exam has been held, you can actually request a copy of that from VA and you can read over it. And if you ever see a portion on there where an examiner mentions something like a secondary condition like the radiculopathy, but for some reason you weren't service connected for it, if that examiner says that it is related, you could use that CMP exam as evidence to file a claim for an increased rating in your back or for the radiculopathy itself.